All right, I guess we should go ahead and get started. You ready, Bruce?
I am.
Awesome. Well, thank you so much, everybody, for joining us. Really appreciate you taking the time today. I'm excited to be presenting here today with my one of my favorite people in the world, Bruce Gehring. He is the man at Allegiance Group, and we're going to be talking today about deductible season, which is probably something that's very relevant to all of us on this call. Very difficult time of year sometimes. Is that right? I mean, going from my provider years, I know that we would get to deductible season and sometimes we would see cash down as much as 30, even 40% during that, starting about mid-January through about mid-March, right? And it gets a little ugly that time. It gets a little difficult. And so today we just want to talk to you guys about some strategies to weather the deductible storm. I'll start out by introducing myself, and then Bruce, I'll hand it over to you. I'm Joey Graham. I'm the Executive Vice President and General Manager here at Prochant. Prochant is the nation's leading HME and pharmacy reimbursement service. I've been in the industry for over 20 years now. I actually started right on the ground floor as a warehouse technician at an HME provider as soon as I graduated college. And basically been in that role ever since, working my way up the chain of command through a provider, all the way up to general manager, and then moving to a software provider as well, Brightree, and acting as a senior consultant there, traveling the country, working with providers like yourselves on challenges like these. Bruce, how about you talk a little bit about yourself?
You bet. Well, good morning, everybody. My name is Bruce Gehring. I'm Senior Vice President of Allegiance Group, and been in this industry now for over 13 years, going on 14 years, and certainly are well aware of the changes that we've gone through, and certainly the pain points that you feel. And our business is all centered around the patient pay process. So we have teamed up with Joey and his team on a number of occasions to help providers like yourself really figure out what they need to do to be more efficient, more effective, and certainly keep more of that cash in your pocket. And that's really what we're talking about here today. So Joey, I'll hand it back to you and you can kind of go through the agenda.
Yeah, sounds good. Let's kind of just go over a brief agenda for what we're going to be talking about today. First, we're going to talk about the deductible dilemma, and Bruce is going to do that. He's going to talk about this is something that happens every year. This is some of the risks that we're seeing. He's also going to talk to you about your education policy, your collection policy, reviewing that collections policy with your patient and what are in those collections policies. What do you need to make sure is there? Then I'm going to talk to you about educating your patients on their financial responsibility during intake. We're going to talk about deductible hold, which is a very common strategy that providers use, as well as handling payer changes, another very common theme this time of year. Hand it back to Bruce. He's going to talk to you about credit cards and getting those cards on file, those recurring charges on file. And he's going to finally wrap it up talking to you about payment plans. As we go, if you have any questions, please don't hesitate to type your questions into the Q&A box or the chat box. If we happen to run out of time, we'll respond to you directly. This is a 30-minute format for this webinar. We're hoping to kind of hit you with some great information and then let you continue on your day. Hopefully you're having a chance to grab some lunch or something like that as you watch us. So with that, Bruce, let me hand it back to you and you can talk to us about the deductible dilemma.
Fantastic. Thanks, Joey. Let's start by asking why deductible season creates such a dilemma for providers in our industry. It really comes down to people often feel ashamed of their medical debt. We know many people view their medical debt as a moral obligation to pay their bills, and they consider it a failure when they can't afford them. In fact, Kaiser Family Foundation reports some people will forego the care they need, including doctor's appointments, tests, and prescriptions, and are probably struggling to pay other bills, depleting their long-term savings, damaging their credit, and even in some extreme cases, declaring bankruptcy. Medical debt is more common than you think. According to a 2019 report from the Journal of General Internal Medicine, 137 million people faced financial hardship due to medical bills. And the problem is not just affecting low-income households or uninsured consumers. There's people that have great incomes that are faced with financial hardship. And this comes back to a lot of what's happening in the insurance industry. So we know you have a variety of patients you work with every day, but for our discussion here today, we wanted to look at one segment, just as an example, in a little bit more depth, individuals covered by employer plans. One of the main reasons for growth in general annual deductibles has been the increase in enrollment in high deductible health plans. And this, you can see here from this chart, is the percentage of deductibles over $1,000 has risen from 33% in 2009 to 69% in 2019. There has been a complete flip in the employee's contribution to their health plan. And this is all in that deductible space. So when you couple higher deductibles with the fact that nearly 40% of adults in 2018 could not cover an unexpected expense of $400 using cash savings or credit card, which could be paid off in the next billing cycle, just reinforces the fact that you have to look at your processes from intake and certainly within that 39 or the first 90 days of generating your open AR. Here's another way of looking at this challenge. Depicted on this chart is showing how much we owe in medical debt. And the largest category is 26% of Americans owe $1,000 to $5,000 in medical debt right now. And 41% of us owe over $5,000. So no wonder we have an issue with deductibles. And, when you're competing with rent, food, utilities, and other bills that, need to be paid, this really puts pressure on us considerably. In recent studies, 50% of consumers are one sickness away from serious financial trouble. Therefore, if you're not asking for your money that you're owed, other organizations are. And if you're not, you're probably not going to get it in their family household budgets. So you have to look at your policies and procedures up front. And that takes us to reviewing your collection policies. So, what can you do or what should you do to minimize the risk you face with the deductible dilemma? You start with reviewing your collection policy. Before the start of the year is the best time to do this, to establish the standards you want to follow for the coming year. But if you haven't already done so, there's no better time than the present to get started. And so you ask, why do you need a collection policy? I mean, obviously this is rhetorical, right? You've got to identify, and this gets back to, your patient group, who you deal with on a day-to-day basis. Identify the most common situations your intake and billing team are going to face. And you have to establish procedures to address those situations consistently. So everybody's doing the same thing the same way. You got to make sure your policies are consistent with your mission and the purpose of your organization. And that really is sitting down with your team, obviously looking at your goals, determining what you're going to do and how you're going to manage these situations, and then establishing a pathway forward for that patient and your organization so you can provide the services, the goods, the therapies, whatever you need for that patient, and you have a way to get reimbursed. And it's easy to look at, gosh, this time of year, I'm not going to get reimbursed until they've met their deductible. But you've got to look at those policies and procedures, because you need to make sure that the responsibility is squarely on the shoulders of the patient, so they understand what their responsibility is up front and know what to expect, because they know they have a deductible. They know they're responsible for out-of-pocket expenses. Now hold them accountable. And I know that might sound harsh, but it's not. You have to stay in business. If you're going to continue to provide the services and the goods to the people, you've got to get reimbursed for those things. So you got to look, the next part of this is just really looking at your workflow processes and make sure that your procedures, or you have the procedures in place to manage those various scenarios that you've identified. And once you've identified them, you then are now making sure that you have all of these things in writing. And you've got to make sure that you communicate, review, and train on these procedures, so you're assuring your staff will treat every patient the same way in the same situation. And I know that sounds, fairly, rudimentary, but the fact is, a lot of people don't take the time to sit down and really look at what they're wanting to accomplish with their collection policies and procedures to impact the recovery of those patient pay dollars, because that's what you're really dealing with when you're talking about deductibles. So next, Joey's going to discuss, educating the patient at intake. Joey?
Absolutely. Yeah. And Bruce, I want to mention that first chart you showed with from 2007 to current, that the spread in the deductibles, that is just shocking to see, but I bet all of us feel that, in our own personal plans. Those deductibles every year, they're ratcheting up every single year. I have what I would consider a strong policy, a strong United Healthcare employer policy, but I still have several $1,000 deductible. And it was very different several years ago.
Yes, it was.
It was. So
it was.
That's an amazing slide there, and it really shows where things are going. That patient pay patients are taking more and more of the burden of their healthcare. That's the bottom line.
They are.
What's happening. Now, when it comes to educating patients on intake, everything starts with intake. So your patient, they go to the doctor, they go to the hospital, they get treatment for something, and they receive a prescription for one of your products, an HME or pharmacy product. That prescription, along with hopefully some supporting documentation, makes its way over to your company, and now it's ready to be filled. So during the intake process, you're going to do something that's very critical called insurance eligibility verification. That eligibility verification process is that key step for you to determine who is paying how much for this, right? And in what order. In other words, I'm going to figure out who's my primary, who's my secondary, is there a secondary, or is it going to go straight to patients? So I'm figuring out exactly who's going to pay these bills and how much are they going to pay. We've all had these conversations with our doctors' offices where you're in network, you're out of network, and of course that drives which benefits you get. Your insurance is going to cover X. The remaining responsibility of whatever is going to be yours. How do you want to handle that? And that's where you get to this critical juncture where you need to let the patient know what that collections policy is. That's why you have the collections policy Bruce just talked about, is so that when you get to this point in the conversation, there's something there. We're not making it up. We're not trying to be nice or trying to figure out what's the best way to do this. We have a collections policy that we follow, and we can be very clear with our patient. You know, our policy is to put a credit card on file or prepay these balances. And it's not, will you be making a payment today? It's, is that going to be Visa, MasterCard, Discover, or American Express, right?
Exactly.
It's a very different way of looking at it. It's not optional. This is just the way we do business. You have got to get that card on file, and we're going to talk more about that, or you've got to get that payment up front. Otherwise, you know, what I call the traditional dump and chase model of patient collections. I mean, I think that's the model that that Bruce, you were solving for as you guys created Allegiance Group. Is
Right.
That dump and chase model is, don't worry, patient, I'll send you a bill. Don't worry about it. Bill's in the mail. When you do that, your collections rate at the top end is 50%, and that's at the top end. Many providers, I'm sure you see it all the time, Bruce, they're collecting 40%, 30% on
Yep.
these monthly statement runs.
Yep.
It just doesn't work, right?
And they do it over and over again. It's like
Right.
the definition of crazy, right? You know, same thing
Exactly.
over and over again, expect different results.
Exactly. So let's talk about one of the most common strategies for that we hear about during deductible season, and that's called the deductible hold. Implementing a deductible hold is something that many providers swear by, although many other providers swear against it. I just want to put that out there. The industry is very divided when it comes to this particular strategy, but I can tell you that the providers who do it swear by it. When used properly, a deductible hold will maximize your insurance reimbursement and minimize the amount that gets set to patient responsibility due to hitting the patient's deductible. The idea is we do better collecting from insurance companies than we do collecting from patients. And so what we want to do is temporarily hold our insurance claims so that some other provider takes that deductible hit. So that when our claim finally does process through, it's going to go ahead and pay instead of getting a $0 check that's set to deductible. Now, before we go further, I want to make sure, you know, we have to have cash stores. We have to have liquidity to be able to do this. This is not, with the beginning of the presentation, it said, this is to help avoid a temporary cash flow slump. Unfortunately, a deductible hold will create a temporary cash flow slump purposefully, strategically, but it's something you have to be prepared for. You know, it's not inexpensive to do a deductible hold. Now, as it relates to some of the things that are on the slide, especially like your payers, I would guess that a lot of your billing systems already have functions, logic built in to handle a Medicare deductible hold. That's pretty common. Here's the thing about the Medicare deductible, by the way, it's only $203. The Part B Medicare deductible is $203 this year. So you think about it, your claims, you know, it's going to take very many claims to meet that deductible, I guess is my point. So how much Medicare we hold is something we really want to think about, because it's only, again, $200. Then again, maybe you can hold it for a month, let somebody else take that $200 hit, and then you get your claims in there. A lot of providers do that. But really, when you think about the power of a deductible hold, potentially it's going to be on those commercial payers where you have those significantly higher deductibles, although you may end up having to hold longer. And then again, it's kind of a gamble, right? Because you may hold your claim 3 months, finally submit it, still get hit with the deductible, because you have, you know, you really just don't know. Unless, of course, you're calling to verify that deductible frequently, which can be very expensive and time consuming. Now, when you do your deductible hold for payers, it's generally a very manual process, but you should closely examine and strategically set your parameters for your hold, specifically like, you know, which payers, or we get a little more granular. So if the patient has Medicare, but they have a Medicaid secondary, we're going to go ahead and release those claims, because we know those are going to cross over, Medicaid's going to pay it, and I'm going to get my money. So I'm not going to hold a Medicare that has a Medicaid secondary. Some providers don't hold any payers that have a secondary payer, because they know they're going to get that deductible EOB. They're going to turn that around right away, try to get collections from that secondary payer, like an AARP policy or something like that. Sometimes we don't hold high dollar claims, especially very high dollar claims. You know, a complex rehab provider with a $20,000 claim, you're definitely not going to hold that claim for deductible, right? I mean, that you want to get that thing out there, get that thing paid. Even if it does hit a deductible, it's still going to pay quite a bit. So you really want to think about some of those underlying parameters as you create your deductible hold program. And finally, you want to make sure you release those claims timely, especially before they hit timely filing, or you're going to have like a time or a dollar sort of threshold. For instance, once a patient's total balance gets up to $1,000, we're going to go ahead and release the claims. Or once we get to 90 days, we're going to go ahead and release the claims. So now let's talk a little bit about payer changes. And so payer changes are something else that happens very commonly during the first part of the year, right? A lot of our patients will have plans that run based on the calendar year. So you do end up running into a lot of payer changes, a lot of ineligible policies this time of year. The best thing you can do is get in front of it. Proactively address these payer changes rather than negatively or kind of reactively waiting for a denial. So the reactive way is to say, I'm going to get a denial for an eligible policy, and then I'm going to go chase down that patient to get their new policy information. The proactive thing to do is to run a batch eligibility against all of your active rentals and get in front of those. So what I recommend doing is run a batch eligibility against your active rentals during January, and then try to get in touch with those patients before the rental date so that you can get that insurance information updated, preferably before the next claim drops. That's going to completely eliminate any kind of ineligible denial. So that's also a great thing to do. You know, this is something that you definitely want to do before January, typically. So now, Bruce, I want to hand it over to you to talk a little bit about card on file.
Great. So as Joey pointed out, obviously there's some strategic things that you need to take a look at from a deductible standpoint and how much you can weather. We found a few minor changes in the patient intake process can deliver some big results. And we know that an efficient intake process can deliver substantial benefits, including raising patient and staff satisfaction, certainly reducing staff workload, and increasing their productivity. But data error elimination is incredible. And the most important thing, you want to be able to have these processes in place to boost collections, right? So that's really the whole focus here. So one of the most important tasks you can perform is capturing and storing credit card or bank information for those patient balances or for reoccurring charges. And getting your staff to require as a standard that you have to have a card on file for whatever the situation is really critical. And being able to track this information is really, really important. If you have a software system that allows you to take a look at things like how many new patients are you getting set up, and how many of those have auto payment set up, or you're capturing the information that you need so that you have the appropriate follow-up, is critical. The procedures you have in place to handle this is extremely important. And do you have mechanisms in place to go ahead and monitor, are credit cards expiring? Those types of things are just little differences that can make a huge difference in the recovery and the success that you have in capturing those dollars as the aging of the accounts move on. In addition to payment information, you've got to make sure that you're capturing that contact information. Do you get their home phone number? Do you get their mobile phone number? Obviously email. I mean, what's the percentage now? 80% of our customers have access to the internet via their smartphone. So, there's no excuse for not being able to communicate with your patient in a manner that they would prefer. And to do that, to have all cylinders firing, you've got to be able to go ahead and not just chase the statement or the patient with statements, paper. You've got to be able to have e-delivery. You've got to have text messaging. You've got to be able to communicate with the patient in the way they prefer and, in a channel that they are receptive to. And that's going to get you the best bang for your money. And lastly, you got to make it easy for patients to pay. Certainly we recommend offering a payment portal so that patients can go on and pay you directly. And if you have a patient portal that allows you to communicate and allow them to set preferences for the way that they're being communicated to, gosh, it just makes it so much easier. It just does. So those are the critical things that you need to think about when you're talking about card on file. Having this process automated is extremely important. Who wants to store and be responsible for PCI, compliance and run credit cards every month? Do it automatically. Allow the system and your software system to manage that for you. It's a huge benefit.
Hey, Bruce.
Yes.
I want to jump in real quick and just say something else that I've kind of learned recently is in terms of making it easy to pay, there are some new payment methods out there that are kind of new kids on the block in terms of people being able to use them frequently. But I've heard of providers, for example, taking payment via, maybe you've heard of Cash App or Venmo.
Mm-hmm.
These are two different services that you kind of pay with your mobile phone.
Right.
And so in terms of especially the younger patients or maybe some lower income patients, to give them solutions like Cash App, Venmo, PayPal, those kind of payment options, being a little more flexible on the payment options might be something that you could also look at.
Absolutely. In fact, Joey, that's why we just launched, pay by text, because, let's face it, if you're getting a reminder that payment is due and you can connect to the portal directly from your smartphone, I mean, it just makes it so much easier for the patient to get that payment back to you, and you're not dragging because of the U.S. Postal Service, checks in the mail. It just is a huge advantage. So, let's go to payment plans, because this is part of what Joey's talking about. And if you're one of those patients, the 40% that cannot pay and at once, you've got to be able to provide options for them to be able to set up a method of payment that allows you to go ahead and, yes, you're self-financing, but the fact is you're getting payment and a commitment to pay versus them just ignoring you. And again, fighting for whatever, are they going to pay their cable bill or are they going to pay their medical bill? Those are the things that you were up against. So you've got to make the terms applicable for your market and your patient. So, if somebody has, $500 bill out there, what are you going to accept? Are you going to allow them to do a $50 payment or whatever? But you've got to think about those things based on your demographics and what makes sense for your business. What are you willing to go ahead and carry and be able to go ahead and establish, those financial solutions that you're willing to live with. And again, it gets back to what Joey said earlier. It's got to be strategic, right? So, if patients ignore your collection calls and letters, you've got to outline the steps in your collection policy on how you're going to manage those situations. And as things become past due, what are you going to do with them? So all that has to be addressed in your collection policy. But again, it's following those policies consistently. So you have established expectations for all of your customers, and everybody is being handled the same way. So there are some things that you can take a look at. The proactive communication obviously is critical, but you may even consider some things like, discounts for full payment. I mean, again, it's going to cost you more chasing stuff over, forever, versus if you give a little bit of a discount to go ahead and get somebody to pay. Those are things that you can consider. Again, it has to be strategic, has to make sense. And, if you're willing to pay, we can offer a percentage discount off your bill right now, to incent them to pay. And then settlements usually involve writing off, a portion of the balance. You've got to be willing to, accept what that write-off amount's going to be. And again, choose, some staff members on your team that manage that for you. So you have a consistent policy in place so that, it's just not randomly, I'm going to waive 50% of the bills so somebody can pay. If you're not, if you're not consistently looking at that, training it, you have it in writing, you don't know what you're going to get. So make sure that those policies and procedures are in writing, being trained on, and people are following them consistently. And then you'll be able to go ahead and manage the process a little bit more. Joey, I think you have some thoughts on this as well.
Yeah, I appreciate it, Bruce. And I know we're right here at the end of our time, folks. Thank you for being with us today. My final thought here with these payment plans and with this whole situation is a lot of providers do things a little bit differently in Q1 than they do the rest of the year. And that means that maybe the statements look a little different in Q1. Bruce and I were talking about this before the call started, but even at Allegiance Group, they have the ability to generate a special kind of statement during deductible season that kind of outlines, hey, patient, this is a deductible, and maybe even get those out the door a little quicker than you normally would. And I would say the same thing on your secondaries. As those primary EOBs are coming in and you've got it set to deductible, the patient has a secondary. Maybe you have a process to do paper claims once a month or something, but during Q1, you might do that every day or every week just to get those claims out the door quicker, to get that cash back in a little faster. It's all about being proactive rather than reactive. But that's all we got for today, guys. I know we're right at the end of our time. Thank you so much. We will answer any questions that came through directly to you guys. And please don't miss our next webinar, which is going to be in about a month. Where we're going to be talking with Allegiance Group about kind of their collections process and kind of what makes it different. So I'm pretty excited to talk about that with Bruce. Great.
Joey, thank you. As always, it's a pleasure to team up with you and your team. The expertise that you have from a collection and, certainly from an insurance processing standpoint, it's invaluable. And I think that if you have any takeaways from today is that, looking at this process and establishing procedures to consistently manage it is the key. And hopefully you heard something that might spark, some ideas that you can, deploy today and help you capture some more of that cash.
That's right. Thank you guys so much for joining us today. We look forward to seeing you again.
Thank you.